Good evening everyone, respected ma'am and my dear friends. Myself Queen Borwa, roll number 43, BSc Nursing third year. Today I am going to present a seminar on the topic eye disorder. Eye problem, everyone have suffered from this at some point in their life. For many people, it become the part of their everyday life. There are different conditions of eye. There are some are minor that can resolve by itself, but some are severe that can lead to severe visual impairment. There are various conditions due to inflammation or non-inflammation or due to muscle impairment.
Incidence of eye disorder. Most children had a normal examination, while refractive errors, amblyopia, and strabismus were found in 15%, 3.6%, and 7.3%. And corresponding rates for children without eye strain were 9.9%, 1.4%, and 1.8%. Now the definition of eye disorder. Eye disorder defined as any deviation from the normal structure or function of the eye that is manifested by a characteristic set of symptoms and signs. Means eye disorder is any deviation, means any difference from the normal structure or from the normal function of the eye that due to inflammation or infection or due to other condition like impairment of eye muscles. Now the eye disorders are differentiated as infection and inflammatory condition and non-inflammatory conditions and impairment of the eye muscles. According to infectious and inflammatory conditions, there are 4 types. First is conjunctivitis, second is ophthalmia neonatrum, third is retinitis, and fourth is stay. According to non-inflammatory condition of the eye, first one is cataract, second is glaucoma, and third is ptosis, and fourth is refractory errors. In refractory errors, there are myopia and hyperopia. And disorder of impairment of the eye muscles, it's strabismus. Now coming to the anatomy and physiology of the eye. The eye is our organ of sight. The eye has a number of components which include but are not limited to the cornea, iris, pupil, lens, retina, macula, optic nerve, choroid, and vitreous. Cornea is the clear front window of the eye that transmits and focuses of light into the eye. Iris, it is the colored part of the eye that helps regulate the amount of light that enters. Pupil, it is the dark aperture in the iris that determines how much light is let into the eye. Lens, it's transparent structure inside the eye that focuses light rays into the retina. Retina is a nerve layer that lines the back of the eye, senses light, and creates electrical impulses that travel through the optic nerve to the brain. The macula is a small central area in the retina that contains special light sensitive cells and allows us to see fine details clearly. The optic nerve, it connects the eye to the brain and carries the electrical impulses formed by the retina to the visual cortex of the brain. And last, the vitreous, it clear jelly-like substance that fills the middle of the eye. Now the physiology of the eye. The eye is a sensory organ. It collects light from the visible world around us and converts it into nerve impulses. The optic nerve transmits these signals to the brain, which forms an image, so thereby providing sight. According to infectious and inflammatory conditions of eyes, first one is conjunctivitis. Conjunctivitis or pink eye is an inflammation of the conjunctiva of the eye. The etiologies are allergic reaction, infection by bacteria or virus. The most common bacterial causes are Haemophilus influenza, Streptococcus pneumonia, and viruses are adenovirus and herpes virus. Next, coming to the pathophysiology of conjunctivitis, due to microbes enter the eye on contact with the infected object, that leads to the inflammation of the eye, and it leads to dilation of blood vessel of eye, means it enlargement of blood vessel of the eye, and that causes the swelling, redness, cloudiness, and discharge of the eye, that leads to conjunctivitis. Next, the clinical features of conjunctivitis. First is redness of eye and tearing and itching in eyes, and flaky or sticky substance on eyelid margins. Photophobia means fear of light, and drooping of upper eyelids, and periorbital cellulitis, pain in eye, and fever. Next one is diagnostic evaluation. We have to collect the proper history of the patient, and physical examination. We have to examine the patient eye for redness, swelling, and the next is slit lamp test. A slit lamp is an instrument. It consisting of a high intensity light source that can be focused to shine a thin sheet of light into the eye. It is used to conjunction with a bronchoscope. Next one is cultural test. It is done to see the bacteria or viruses. Next, coming to the management, we have to maintain the proper hygiene of the baby and provide adequate rest, and avoidance of irritating substance, and antibiotics should be administered. Eye drops or ointment with hygiene, and antiviral agents and antihistamine eye drops. So the next condition is ophthalmia neonatal. It is an efficient discharge from eye of a newborn within 21 days of birth is known as ophthalmia neonatal, and most cases develop this condition within 48 to 72 hours of life. It is mostly bilateral, mean both sides. Etiology, microorganism like Neisseria gonorrhea, Staphylococcus, Pseudomonas aeruginosa. Next, the pathophysiology. Due to infection, the blood vessels dilate, and there is a formation of new blood vessel around the pupil, and polymorphs are present in the epithelium, which leads to purulent discharge and exudate formation in eye. Clinical features are eyelids are tense and swollen, and conjunctiva is congested and swollen, and excessive tearing or turbid and thick discharge from eyes. And diagnostic evaluations are history taking, eye examination, and cultural test for identifying the microorganism. Next is management. Early and appropriate treatment to prevent the consequent severe sight impairment, and antibiotics, ointment or eye drops are given, and eye drops like gentamicin and erythromycin. Eye care, the infected eyes are cleaned with sterile swabs, moistened with normal saline. Each swab will be once only for wiping the eye from inner canthus to outer canthus. Wash eye frequently as possible with warm sterile normal saline. And the next condition is retinitis. It is an inflammation of the retina, is known as retinitis. Etiologies are allergic reaction to some endogenous toxin, and cytomegalovirus, herpes zoster, and candida. Pathophysiology, due to infection or inflammation occurs, it leads to exudate formation in the eye, and then exudates pass through the branches membrane and reach to the retina, and exudates from retina that reaches to the vitreous, and then it floating a black spot in front of eye, and retina become. Then disturbation of images and blurring vision that leads to retinitis. Clinical features like floating black spot in front of the eye, and distortion of images. Objects appear smaller, objects appear bigger, and subjective flashes of light due to retinal irritation. Diagnostic evaluation is fundoscopy. It is an exam that uses a magnifying lens and a light to seek the fundus of the eye, means back of the inside of the eye, including the retina and optic nerve. The next is culture test. The management of the retinitis protect the eye from light by wearing dark goggles, and atropine eye drops are still thrice daily. Eye care should be done using warm sterile water, and corticosteroid may be helpful in arresting the inflammatory process. Sodium salicylate may be given for pain relief, and antibiotics are given, and antihistamine for allergic reaction. The next inflammatory condition are stay. Stay is an infection of the subaxis glands near the eyelids. A pustule in the eye lashes is known as stay. Etiology are bacterial infection, bacteria like Staphylococcus, and viral infection. Clinical features are pustule in eyelashes, pain and tenderness, localized swelling of eyelids, redness in eye. Now the diagnostic tests are eye examination. And the management, warm and compress must be applied on eye several times in a day. Eye care is done frequently, and antibiotics are given, like eye drops are given. So next, the non-inflammatory condition of eye. The first one is cataract. Cataract is the development in the crystalline lens of eye, as light cannot pass through the opacity. Vision become blurred. There are several types of cataract. These are unilateral and bilateral. Unilateral means only one side, and bilateral mean both eye. And next is partial or complete, and next is congenital or acquired. And now the etiological factors are infections like measles or toxoplasmosis, and maternal malnutrition or galactosemia, and Down syndrome or mental retardation, trauma, and glaucoma. Now the pathophysiology of cataract. The lens capsule is formed during the 5th week of the gestation. It is clear membrane that allows light to enter the eye and refract the rays for a clear image of retina. If there is any region that interferes with lens development, the lens becomes milky white and cloudy, and obscuring light rays in the vision. Next, the diagnostic evaluation of cataract. First one is history taking, collect the proper history of the baby, and next is Snellen visual acuity test. A Snellen chart is an eye chart that can be used to measure visual acuity. Snellen chart are named after the Dutch ophthalmologist Herman Snellen. The visual acuity test is used to determine the smallest letters that can read on a standardized chart. Special charts are used when testing a distance shorter than 20 feet. Some Snellen charts are actually video monitors showing letters or images. The next is ophthalmoscopy. It's also called fundoscopy. It is a test that lets a doctor see inside the back of the eye, which is called fundus. The doctor can also see other structures in the eye, and they uses a magnifying tool called ophthalmoscope and light sources to see inside the eye. This slit lamp test. It is an instrument consisting of high intensity light sources that can be focused to shine a thin sheet of light into the eye, and it is used to conjunction with a biomicroscope. Next is management. There are no medical treatment, and surgical management are intracapsular cataract extraction and Next is phacoemulsification. The next one is glaucoma. Glaucoma is the condition of increased intraocular pressure causing it gradual loss of sight. Types are congenital and juvenile glaucoma. Now the etiology, it is related to the consequence of elevated intraocular pressure. And a proper balance between the rate of aqueous production and rate of aqueous reabsorption is essential to maintain the intraocular normal limits. When the rate of inflow is greater than rate of outflow, intraocular pressure can rise above the normal limits. If intraocular pressure remain elevated, permanent vision loss occurs. The pathophysiology, due to defective development of the trabecular meshwork, sufficient amount of aqueous humor is not carried out of the intraocular space. This leads to accumulation of aqueous humor in the anterior chamber of eye and resulting in increased intraocular pressure. This increased pressure causes damage to the ganglion cells of retina, it leading to necrosis of the optic disc, which result in blindness. Clinical features are excessive tearing, involuntary closing of eyelid, photophobia, enlargement of eyeball, clouding of cornea, pain in the eyeball. Diagnostic evaluations are tonometry. Tonometry is a test to measure the pressure inside our eyes. The test is used to screen for glaucoma. It is used to measure how well glaucoma treatment is working. This is fundoscopy. And next is perimetry. Perimetry test or visual field test. Now the management, beta blockers are given and carbonic anhydrase inhibitors are given. Alpha-2 agonist given and combined therapy, and the surgical management are goniotomy. Goniotomy is a surgical procedure in which the doctor uses a lens called goniolens to see the structure of the front part of the eye. An opening is made in the trabecular meshwork, the group of tiny canals located in the drainage angle, where fluid leaves the eye. And next, surgical management is trabeculotomy. It is a surgical procedure much like trabeculectomy. A piece of tissue in the eyes drainage angle is removed to create an opening. This new opening allows fluid to drain out of the eye. The next condition is the ptosis. Ptosis is the drooping of upper eyelid caused by weakness of ocular muscles is known as ptosis. It occurs due to weakness of the muscles. Etiologies are myasthenia gravis or eyelid injuries or third nerve palsy. And diagnostic evaluations are assessment of the child shows drooping of eyelid and impaired vision of as the eyelid covers the pupil. Clinical features are drooping of upper eyelid. Management are external approach levator advancement. It used to raise the eyelid, and patching of the eye is needed in post-operatively for few days. And the next is refractory errors. First one is myopia. Myopia is the condition in which the parallel rays from distant object focus in front of the retina. Their types are congenital myopia, simple myopia, and progressive myopia. Now the pathophysiology. When the length of eyeball in anterior posterior axis is more due to overdevelopment of the eye, or if one refractive index of level is greater than normal, or if the curvature of cornea is greater than normal, it causes the light rays to focus in front of the retina. Clinical features are the child usually complains that he or she cannot see the writing on blackboard in school, or the child complains of headache on reading, and the child is seen holding books closely to eyes while reading. Management are to defects should be corrected by prescribing a concave lens or appropriate strength for the child, or photorefractive keratotomy laser surgery. Hyperopia. Hyperopia is the condition in which parallel rays from a distant object focus behind the retina. Now, pathophysiology, when the length of eyeball in anterior-posterior axis is shorter than normal, or if the refractive index of lens is low, or if the curvature of cornea is less than normal, the light rays focus behind the retina, resulting in difficulty with near vision. And clinical features are both for near and distant objects are not seen. Child complain of reading problems, headache, blurring of vision, or heaviness of eyelid or redness of eye. Management are the refractory error can be corrected by using convex lens of proper strength. Now the disorder of impairment of eye muscles. First one is strabismus. The deviation of visual axis from normal alignment is known as strabismus. Types are paralytic type or non-paralytic. Clinical features are blurred vision, double vision, or both eyes not focused on same eye strain or headache. Diagnostic evaluations are Hirschberg test. To perform the Hirschberg test, the doctor shines a pen light on the eye from a distance of about 50 cm and observes the position of the light that reflects off the cornea. If there is no squint, the reflection will be at the center of the pupil. The next is uncover test. This test, the first eye is covered for approximately 1 to 2 seconds. As this eye is covered, the uncovered eye is observed for any shift in fixation. And now the management are in pharmacological therapy, use of miotic drugs makes accommodation easier, and occlusion therapy using an eye patch to cover the non-emboliopic eye for a couple of hours is each day has been the principal means of treatment. The sensitive period in which vision loss can develop be recovered is generally up to 6 years of age. Next, coming to the nursing management, now the assessment. We have to assess for red light reflex, especially in newborn. Absence of red light reflex is decades congenital cataract. Inspect eyes for redness of conjunctiva, cloudiness of cornea, or excessive tearing. Assess the visual acuity routinely in infants and children. And the nursing diagnosis, the first one is pain related to inflammation or surgery or due to increased intraocular pressure. Goal is to reduce pain. Interventions are assess the pain level, minimizing the pain by applying cold or warm compress to the affected part, allowing protection from bright light in photophobia. Second is the third intervention are allowing protection from bright light in photophobia and provision of dim light, and administering analgesic and other therapy as directed, allowing the interaction with others and diversional activities. And the second nursing diagnosis is altered growth and development to disturbances of visual stimulation. Goal is to promote normal growth and development. Interventions are promoting normal growth and development through various sensory stimulation. Assess the child, for example, manipulating object, hearing sound, noting smells, and providing other available opportunities of tender loving care. Third nursing diagnosis is risks for infection related to exposure to environmental hazards. Goal to reduce risks of infection. Interventions are assess the level of risk of infection, preventing infection by caring and cleaning eyes with aseptic precaution, following basic principles of eye care, perform proper hand hygiene, administer antibiotic or other medicine as prescribed, teaching installation of eye drops, application of ointment, use of eye shield, etc. For nursing diagnosis is risk for injury related to reduced visual acuity. Goal to reduce risk for injury. Interventions are assess the level of risk for injury, preventing injury by instructing about safety measures at hospital, home, school and community, proper use of eyeglasses, keeping safety from falling off, dirt and damage, traffic rules.